Should I be worried about having multiple MRI scans for my acoustic neuroma?
So we use MRI scans to track acoustic neuromas both before and after treatment. So a common question that arises is, what is this frequency of MRI scans, and are MRI scans harmful to my body? Is there some trade-off I need to consider between monitoring my tumor and obtaining an MRI scans? So there are two issues that I want to address with MRI scans. The first is that MRI scans, fortunately, are not radiation. Unlike X-rays, chest X-rays, mammograms, or CT scans, those are all imaging modalities that involve radiation. MRI scans involve zero radiation. So just obtaining an MRI scan does not expose you to any radiation at all. So from that standpoint, there's not an issue with obtaining multiple MRI scans. A second part of this MRI scan question has to do with the contrast dye that is given. We know that acoustic neuromas light up with the contrast dye and appear as a discrete white tumor on the scan that typically shows brain as being gray and bone being black, and therefore giving the contrast makes the acoustic neuroma highly visible on the MRI scan. The contrast agent is typically gadolinium, which is a type of metal. I always explain to patients it's similar to copper or zinc. Gadolinium is an element on the periodic table that exists in chemistry classes, and it's typically flushed out by your kidneys. So for those of you that have had MRI scans, they'll often tell you to drink a lot of fluids after your MRI scan. That's mainly to flush the gadolinium out of the body. So the question arises is it okay to get contrast many times, given that you have to keep flushing this contrast agent out of the body? The strategy that I use to deal with this is that MRI scans now have become so advanced in terms of technology that they can often show the acoustic neuroma tumor on non-contrast sequences to an experienced neuroradiologist or experienced neurosurgeon. So I typically will obtain the first few studies of an MRI scan with contrast, and then once we've assessed the size, shape, location of the tumor and can have some certainty of seeing it on the non-contrast sequences, I typically switch to non-contrast MRI scans, as long as they're good quality MRI scans and I can still measure the size of the tumor. This allows me to avoid the issue of contrast dye on a repeated basis in patients long term.